We put together a care management system. It's built around clinical processes. It's been associated with dramatic improvements in clinical outcomes. I can document about 2,000 lives per year in the Intermountain system of people who a few years ago would have died who don't today. And as you understand, mortality is kind of the tip of the iceberg. Dramatic effect on suffering averted, on function restored. That's been associated with equally dramatic reductions in our cost of operations. We documented through last year $440 million in savings through waste elimination within the Intermountain system. That's about 10% of our total cost of operations. Our goal by 2016 is to take out $700 million, about 15%, and we're on track to do it. We believe that care that is not accessible, by definition, is low quality. And accessible means affordable. Now, most often, higher quality means lower cost. And I think that we've understood that principle, we've applied it broadly. We do not save money by rationing care or by queuing patients. We save money by eliminating waste and delivering better clinical outcomes.
Our main speaker today is Brent James, who is a cancer surgeon by background, an academic cancer surgeon, who is now the Chief Quality Officer of Intermountain Healthcare, which is a not-for-profit healthcare system about twice the size of NHS Lothian in Utah in the United States of America. He's also the director of their Institute for Healthcare Research Delivery, and he's a world-renowned expert in quality of care and quality improvement. And part of our approach in Lothian with the Clinical Change Forum has been to engage with our own senior clinicians to help us respond to the huge challenges we face. But it's not just about internal engagement, it's very much about reaching out to learn from other high-performing healthcare systems across the globe. And there's no better example of that than Intermountain Healthcare and Brent James in particular.
We have a method for identifying, measuring, then managing clinical care delivery that makes those processes of care transparent to clinicians, physicians and nurses, and to the patients that they serve. That transparency makes it easier to do it right, and nearly always results in significant improvements in clinical performance. That forms the framework for systematic improvement, for a learning healthcare system where you can learn from every patient so that we're better tomorrow than we were yesterday, and far better in a year or 2 years than we were a few years ago.